Hey drivers, Dr. Nuesse here again, another video. This one we are talking specifically about diabetes as it pertains to the DOT physical and answering the question, can a diabetic pass the DOT physical, and what we, the medical examiner, are actually looking for when we evaluate a diabetic when taking the DOT physical. So first things first is I have done a video in the past on this channel on diabetes as it pertains to the DOT physical, but that was specific to insulin-dependent diabetics. So if you are a type 1 diabetic or you use insulin to control your diabetes, this video will not pertain to you. There are a whole series of other hoops that you have to jump through. I've done a video on it in the past. I will link that video right up here. So if you're insulin dependent, please check out that video. This video will be for patients that have diabetes but are not dependent on insulin. All right. So there's 7 pages in the Certified Medical Examiner Handbook that are dedicated to diabetes. So there's a lot to it. I want to let you know what we are looking for and what you can do to help maximize your chance for passing if you do have diabetes. All right, so let's look at the handbook. Okay, so first, just a couple facts about diabetes. First, 8% of the population is diabetic. So not just drivers, but 8% of the American population has diabetes. And there are also about 6 million people in America that are undiagnosed diabetics. So they're diabetic, they just don't know it. So there are a lot of people that are diabetics. So what the FMCSA, the Department of Transportation, is trying to prevent mainly when we evaluate a diabetic patient is we're trying to make sure that they are not going to have a severe hypoglycemic event. So there are a lot of complications that go along with having diabetes, things like ketoacidosis, but these come on more slowly over time. What we, the Certified Medical Examiner, are trying to figure out is it safe for you to operate a motor vehicle? Bottom line, I mean, we're not really all that worried about exactly how healthy you are as it relates to your diabetes. Unfortunately, we're just trying to make sure that you are not going to have an episode that causes you to have a wreck, basically. So the major consideration when we evaluate diabetics is hypoglycemia. So hypoglycemia is what causes the loss, or can cause the loss of consciousness, and unfortunately, if think of driving a bus or a big truck, if you lose consciousness and have a wreck, that can be a catastrophic problem. So ultimately, that's what we are looking for and trying to prevent is these hypoglycemic events. Now, if you're a diabetic, we are going to ask you a series of questions. We're going to ask you what medications that you are taking. You might be taking things like metformin, glimepiride, etc. There's a bunch of medications that help control diabetes. And we'll also want to know if you have had any hypoglycemic events in the recent past. These are going to be important questions that we are going to be asking you. We're also going to be evaluating you with a urinalysis. So when we do a urinalysis, we're looking for sugar to show up in your urine. And if sugar does show up in your urine, it can indicate that your diabetes is not controlled very well. And if that happens, we are most likely going to want to refer you to get further testing to make sure your diabetes is controlled properly. We're also going to be looking for signs of severe neuropathy in your extremities. So diabetes, as it advances or if it's uncontrolled, can cause sensation loss in your extremities, your hands and your feet. And if that happens, obviously, again, it might become dangerous for you to operate a motor vehicle. So we're going to be checking for that if you are a diabetic. And unfortunately, in these 2 cases, you might not be able to pass a DOT physical if you have severe neuropathy or if you have had a hypoglycemic event in the recent past. Now, here is some good news. The certification length, the maximum certification length for a diabetic is 2 years. So you can potentially qualify for a 2-year certification if you are a type 2 diabetic. Now, that is much different from a lot of the other real common medical conditions that we'll see when we are evaluating drivers. For instance, high blood pressure. If you are a high blood pressure patient and you come in, the maximum certification that we can give you is 1 year. You can only qualify for a 1-year certification. So the max you can qualify is 2 years. So that's good news. So we are not, again, going to be able to certify you if you have had a hypoglycemic event in the past 12 months. So if you've had one of these issues where you've passed out due to your blood sugar dropping in the past 12 months, we're not going to be able to certify you. And we also, again, will not be able to certify you if you have major sensation loss in your extremities, if you've got peripheral neuropathy that has advanced that we think would cause you to be a danger if you are driving. Now, there is one exception to this rule, and that is a very specific type of drug called an incretin mimetic. If you are taking incretin mimetic to control your diabetes, we will only be able to certify you for 1 year. That requires us to cut your certification down basically in half. So you should know that. If not, check with your doctor if you're taking an incretin mimetic to control your diabetes. Again, we won't automatically disqualify you, but your certification will be cut from 2 years to 1 year potentially. Okay, so just a few closing thoughts here on things you can do to help maximize your chance for passing the DOT physical. And the number one thing I can tell you here is please take whatever medication you've been prescribed by your doctor. Take it just as prescribed. So make sure that you've got the best control over your blood sugars when you come in to take your DOT physical. If you monitor your blood sugars regularly, make sure you're monitoring them and then taking the medication appropriately so that when you come in, your blood sugars are controlled. And then secondly, when we ask you questions about your diabetes, please just openly and honestly answer these questions so we can evaluate you appropriately and make sure that it's safe for you to drive. All right, drivers, please stay subscribed to this channel. The FMCSA is constantly changing the parameters of the DOT physical, and every time they do, I'm going to make an update video. So make sure you're subscribed here, and then please share this with other drivers you think might find it useful. All right, until next time, drivers, stay safe.